Hello, I'm Melissa Schaefer-Thrasher, and I wanted to address a serious public health issue that is affecting our community. The use of tobacco in public areas is a health issue that affects us all. Smoking is the leading preventable cause of death worldwide, and exposure to tobacco smoke causes multiple health problems. Cigarette smoking in public is an issue that needs stricter regulations. Our group believes an increase in age restrictions and more limits on areas for public smoking need to be enforced. The age to purchase tobacco products should also be raised to 21. Smoking kills more people each year than HIV, alcohol and drug abuse, auto accidents, and gun-related violence combined. In 2018, more than 16 million people suffered from a smoking-related disease. Over 480,000 Americans die each year from chronic smoking or exposure to secondhand smoke. Cigarettes can contain over 4,000 chemicals that are released when burned. 250 of these are known to be harmful, and over 50 are known to be carcinogens. It has been known since 1957 that smoking increases the risk of lung cancer, pulmonary disorders, stroke, and heart disease. Increased warnings from doctors and the Surgeon General have only decreased the numbers of smokers by a small amount. According to information from the CDC, in 2016, there were 38 million American adults who smoked cigarettes on a regular basis. This equals to more than 15 out of 100 people in the country who are smoking. Approximately 17.5% are men, 13.5% are women, and the ages are between 25 and 64. Minorities have the higher instance of smoking, with the highest being Native American Indians and Alaskan Natives at 31.8%. Those with lower educations and socioeconomic backgrounds tend to be smokers. Tobacco not only affects the smoker, but the people around them. Secondhand smoke can cause lung problems and other health issues in non-smokers who are exposed regularly. Many people, including children, are exposed to large amounts of smoke without ever touching a cigarette. Employers are affected by the poor health of employees who smoke. The habit creates higher insurance costs and increases lost work days due to multiple employee sick days. These factors diminish a company's overall profitability. There is also a decrease in daily productivity due to employees taking multiple smoke breaks during work hours. The health problems for non-smokers with secondhand exposure and for long-term smokers increases the use of medical insurance resources in the country each year. The economics of smoke-free air policy states that the medical cost for adults who smoke is almost $170 billion annually. Over $156 billion is spent on numerous premature adult deaths and treating people who are exposed to secondhand smoke. There is a lack of smoking education and assistance for those who want to quit smoking. Proactive programs need to be available, otherwise people will be unable to change their smoking habits. Education should be available for adults to show the hazards of smoking, the long-term effects on their bodies, and the personal economic issues that this habit causes. Many states don't have enough funding slated for the implementation of smoking cessation programs. The CDC recommends $3.3 billion annually to be spent on these programs. Without the programs in place, more people will start smoking, and the overall costs for the care for these diseases will continue to rise in the United States. The overall cost of implementing these smoking cessation and education programs would be minimal. The Community Preventative Services Task Force looked at 3 different education models and reported a possible cost of up to $25 per person depending on locations. Substantial savings will become apparent as the programs develop. Property insurance premiums for local businesses and event areas would be reduced due to the low risk of accidental fires from cigarettes. Area parks and event locations would have less maintenance needs and reduced labor hours due to the decrease in litter. An overall savings in hospital costs of over $148,000 per 1,000 people each year would be seen. Education for children should start early. They should be told about health risks of smoking appropriate for their age and encouraged to develop healthy habits that won't cause health problems as they grow. The education would help to decrease the number of young people who start smoking and damaging their health at an early age. If people don't start smoking, the number who need to seek smoking cessation help in the future will diminish. State and local officials need to create regulations for all or certain public areas to be smoke-free. This should include county workplaces, public outdoor locations, and event facilities. Private businesses and locations may determine to what extent smoking should be allowed on their property, but incentives could be offered to those who decide to go completely smoke-free. This impact of this policy will positively affect the entire community. A smoke-free policy will diminish people's exposures to secondhand smoke in public places. Smokers will be encouraged to reevaluate their smoking habits due to the limited areas that smoking will be allowed. This could increase the number of smokers who want to quit and decrease the amount of tobacco products purchased. Healthcare costs would be reduced in the community. Smokers and those who would be exposed to secondhand smoke would not be at risk to develop the chronic diseases associated with the habit of cigarette smoking. A decrease in tobacco-related deaths and illnesses would cost less money to insurance companies and to area businesses. It's important to enact these programs to benefit the health and longevity of our public. There are a few problems that could happen once the non-smoking policies are implemented. Some long-term smokers could claim they are being discriminated against by not being able to smoke freely in public. Workers who can no longer smoke on their employer's property may find different jobs outside the area. Elected officials need to keep the public's focus on the benefits of the non-smoking community and the good that these programs will ultimately do. If these policies are not introduced to the public, we would continue to deal with the negative effects of smoking. Non-smokers would continue to be exposed to secondhand smoke without their consent. More of the younger population would have access to tobacco, and the number of smokers would not decrease but may increase over time. Chronic disease rates from tobacco-related illnesses would continue to rise from long-term smoking or extended exposure to the toxic chemicals in cigarettes. Healthcare costs wouldn't be able to be reduced with an increasing number of people smoking. With these programs, smokers will begin to find it harder and harder to smoke in public and their workplaces. They will have to start cutting back on smoking and looking at changing their habits. Community members will notice that they have a better quality of life and less chronic illnesses related to smoking or secondhand smoke, since their overall exposure will be diminished. After the public sees the positive outcomes from this policy, there will be more support for the non-smoking education programs and restrictions. The changes may be difficult for the community at first, but these smoke-free policies and education may save many lives in the future. Thank you.